Welcome, friends. Thank you for tuning into the show today, the Optimal Health Program, as I've called this for the better part of 40 years. 36 or so on radio. And here to chat with you, talk about some of the latest, greatest studies, what I call now clinical pearls or pearls of wisdom or nutritional tidbits, whatever the right term I'm going to use for social media. Up and coming. We'll let you know. We're working on social media feverishly, so we'll be able to get out some great posts. We're talking about, and I may take a while to set this up, and also use AI to help with this, or I can look for studies on vitamin deficiency, why it's bad, why taking vitamins is really good for you, etc. So we're going to have a lot of this come out through social media. Instagram is Dr. Chris Calapai, all lowercase DRCHRIS, Calapai, CALAPAI. Facebook, Dr. Chris Calapai. I think we also have TikTok we're setting up. It'll be the same thing, Dr. Chris Calapai. So people can look there. If you like, you could sign on, like, subscribe. I don't know what you're supposed to do, but follow and
Depends.
we'll get a lot of
Depends on the
followers.
cert. Why don't you tell the people about our guests we have coming on later?
Today's program is great. We have two excellent, wonderful gentlemen that are veterans that have done a great job for our country, as all have, that were blown up in vehicles and had some major traumatic brain injury, very similar to what our friend Josh had. And Josh, we did a great video with him about traumatic brain injury, and he went from being completely dysfunctional, bounced around to all the different VA facilities, and was really unable to function. And once we did STEM, headaches went away, neck pain went away. Long story short, over a couple of years, got into law school, graduated law school, and is doing extremely well. And fortunately, through meeting him and his perseverance, we're able to get other gentlemen to come to have the stem cell procedure done. And two of those gentlemen you'll hear from today, talking about pretty dramatic changes in their medical condition based upon the stem cell treatment. So we're excited about that. That'll come up at about 3 o'clock, right on the nose. So we'll be able to really give you a great overview of how they've done and how they're doing. Just to start with some of the tidbits, because we're going to take this and put it out all over the place. There's a great study on vitamin D, and this is a global study. The title is Global and Regional Prevalence of Vitamin D Deficiency in Population-Based Studies from 2000 to 2022. A pooled analysis of 7.9 million participants. Really, really big study. When drug companies do studies, because they do most of them, because it suits their agenda to put money into a study and make everybody think that that's the thing that they have to have, blah, 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 you can get skewed information. But this, looking at a meta-analysis of multiple centers with, as they say, 7.9 million participants from 81 countries, talks about vitamin D deficiency. Vitamin D deficiency is rampant. We've seen this in every vitamin D study, whether it's a small study or a big study. We know vitamin D is important for bones, immune response, mood, a wide range of different things. It's a critically important nutrient. The problem is, because it's not a drug, no one's pushing. Most doctors don't test for vitamin D. If they did, and the vitamin D range in almost every lab is between 30 to 100. If you're at 40, they say you're fine, don't worry about it. But you really get great benefits when you're up on the higher end of the normal range, 75, 80 or so. That's where we want to be able to get you to get your best immune benefit, bone benefit, anti-cancer benefit. So very important to get your vitamin D tested. And once it's tested, you want to be in the higher end of normal. You don't want to stay at the lower end or just above being low. So test your vitamin D. With most of my patients, and I have what certainly could be, if I can get somebody to do it, thousands and thousands and thousands of patients over the years where they've all been tested for vitamins. We can see which people are deficient, which are not, which people, when we put them on vitamin D, typically 5,000 units a day, will come up to the 70, 80 range and do beautifully. Which patients might need less, which patients might need more. So it's a very good 40-year history of testing for, correcting, and proving great vitamin levels. So that's something that I've done with every patient. So pretty staggering that the majority, overwhelming majority, I think it's 85%, of these individuals were deficient. So important to learn as much as you can about your body, especially your vitamin and mineral levels. Of course, your hormone levels. As you get older and the hormones drop, you lose function. You age faster. As your vitamins go away and they're not there, then your increase of degenerative process occurs. You'll have more problems with your brain, with your organs. Here's a great study. Another nutritional tidbit. I'm waving because this is where we're going to start to cut some of this and put this onto social media. So this is a second tidbit for the day. Makes it easier for people to know where to start looking at it. 5, 4, 3, 2, 1. Multivitamins in the prevention of cancer in men. Great study. The Physicians' Health Study randomized control trial number 2 talks about multivitamin supplementation, how important that is. This is a study that went on over about 13.3 years, 2,669 men with confirmed cases of cancer. Daily multivitamin use was associated with a significant reduction in total cancer in these individuals. So this is one study out of many, 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 many. And this is information that I need to impart upon everybody. Not only would you want multivitamins and the good B vitamins therein to help to lower homocysteine, which is cardiac risk, but you also want to decrease cancer risk with vitamin D. Third comment, tidbit, pearl, whatever you want to call them. You know what? We should probably ask the audience, should we call them nutritional pearls, clinical pearls, nutritional tidbits, anti-aging, medical, whatever?
All right, to our LFA audience, our YouTube audience, anyone who's listening.
Let's see who comes up with the best topic.
Yeah, love it.
So supplements may offer protection against stomach cancer. A study published in the October Cancer Causes and Control Journal looks at data from 80,000 adults in the South at Duke University School of Medicine. Duke's in the South? Duke University. Someone will know where Duke is. I'm sorry for all the Duke people out there that I don't know exactly where Duke University is. It'll come to me. Looking at the information and, published through the Morehouse School of Medicine, that taking the multivitamins.
North Carolina.
It is North Carolina.
Yes.
That would have been my 11th guess. No, probably my second or third guess.
So we got people in the chat.
They significantly decrease the risk of cancer. So
we got nuggets. We got pearls.
Nuggets, pearls.
We got health pearl of the day. They'll keep coming. Keep coming.
Health tip. Nutritional pearls. Clinical research. Clinical. We'll find it.
Sorry, I interrupted your nugget. So please continue.
That's okay. I'm just looking to see what else we have here for our lovely social media guru that's going to take this good information and make it visible to the whole world and beyond. Yet another great article. 5, 4, 3, 2, 1. High prevalence of vitamin D deficiency in Asia. A meta-analysis. Great study. In case you don't know, I love what they call a meta-analysis. That's multiple facilities, multiple studies. So you may get 100, you may get 500, studies being run on the same topic. All that information is put together with a gigantic number of patients in the study. This was 472 studies, which is awesome. Thank these people, whoever they are that did this. Dr. Zhang, Pu, Li, Thank you very much. 746,564 subjects included in the meta-analysis. The average vitamin D levels were only 39, which is horrible. 32 is absolutely low. And honestly, at 39, you're not really getting any benefit anyway. So the prevalence of vitamin D deficiency in age is very high, increasing the risk of cancers, diabetes, fracture, bone degeneration, lupus, fatty liver disease, thyroid issues, anemia, hepatitis, metabolic disease, dermatitis. A lot of bad things happen when D deficiency occurs. So once again, get your vitamin D levels tested, and then certainly, if you like, give us a call on a Saturday, and we'll give you some guidance on it.
We go. Just a couple comments here. Our Rumble viewers.
The Rumblers.
Hello, Kit Kat Mar. I see you in the chat. Good morning, good afternoon, Dr. Chris and producer Frankie.
Hey there.
We take vitamin D daily, and we do go outside and get what we can from natural sunlight. Good to know this about multivitamins. My husband prefers to take them instead of taking a bunch of vitamins separately.
So it's wise to take a good multi, because if you have appropriate levels of a dozen to 15 things in a multi, you save a lot of money on doing that individually. And I see lots of patients who will take a B complex. They'll take all the different separate vitamin A, E, D, K, C, on and on and on. And they've got, 20 bottles of things at home, which becomes a little daunting, becomes hard to follow. I'd rather have a good multi as sort of the hub of a wheel than some vitamin D with the K, some vitamin C, a probiotic, to round the picture out. And that's based upon a blood test. That's what we do. So we know exactly what you need based on blood test. We will then know exactly what to recommend for you. I'll put them in vitamin packs so you don't have 20 bottles around. And I won't do it personally, but the vitamin manufacturer will put the vitamins that I tell them into the pack. I check off what I want to be done. Morning pack and evening pack. And everybody we've done this on has had pretty significant results when we recheck their blood within the month after they've been on them for a month. And for those individuals that are buying everything individually and spending an arm and a leg, you don't have to do that anymore. And it's specific to your need. And a month after, as I say, we get you on the vitamin pack, we'll recheck those that are low and prove that your levels are perfect. That's the only scientific way to take vitamins. You hear a lot of people on social media and all over the place, do this, do that, do this, do that. There's never an evaluation. And I will tell you, there's never a blood test that looks at over 200 different parameters. I've done that my entire career. And based upon that, we give you the most perfect recommendation. So that's the way it should be done.
We got one person just said that my vitamin D is low. I bought the one, it says D3. What does the D3 mean?
That's the best form. That has all the benefit. D2 doesn't really, but the idea is that, and I want to also go back to the previous person who talks about getting sunlight. It's good to get sunlight. I think that's important. But you're not going to get enough sun exposure to raise your vitamin D high enough. I have people all day long that come up from Florida and they're 10. And people that go on vacation and come back and they're 10. We still don't see their vitamin D getting past 40 or so. So the supplementation is a thing that adding to that will get it up to the perfect range.
We got another one. Since getting heavy metals out, I can exercise better. All the amalgam, filling, and dental work as a kid.
Good. Smart. The question would be, and certainly when we talk to people that have the amalgams, which are 50% mercury, and you look at how that could affect and damage your body. I've seen patients that have had 2 or 3 fillings removed, and because the liberation of the metals was absorbed into the brain, they had tremors and neurologic issues and brain fog and all sorts of horrible things. The reason we do a urine test for metals is that's the best picture of 21 different metals that can come from all over the place. Life brings us all sorts of horrible metals and chemicals and things. And as we see what's coming out of storage and we start to remove them with an intravenous treatment, you start to really deplete all of these things. So for people who've had the fillings removed, it's important because you're taking away the biggest constant release of those into your body. but you still want to do the urine and see how much is there, is being stored. And you want to do the IV to remove those. So that's an important step.
We got someone in the chat says, hello, Doctor and Frankie. Actually getting ready to go get some now. Switching to a new brand. Any suggestions?
There are a lot of companies out there that make good product. Nature's Made. I don't know if Twin Labs is still in existence. But you want to get a product that's well made, that's organic, that doesn't have fillers, binders, excipients, colors, and dyes in it. The company that we use primarily is called Clinicians. They typically will create protocols for doctors, but and overwhelmingly, when we see people, I put them on 5,000 units of vitamin D. Bless you.
Thank
we
you.
test them, we make the recommendation, and retest them. And then we'll test 3 or 4 times a year for their vitamins to make sure they're not going too high. Nobody really goes too high. Nobody takes a whole bottle of a vitamin. But based upon our vitamin pack, they know exactly what to take. And they never go crazy. They never go all over the place. So we're constantly watching that. So that typically is the best recommendation that we make. And then recheck the blood to see where you are.
We got another one that says, my husband is 63. What multivitamin do you suggest? Thank you. She does, and then she added, he does have a bit of a sugar issue, by the way. Calling him out, huh?
Yeah, you may want to use a little bit of chromium to decrease some of the, desire for the sugar intake. Low-carb diet, some exercise, combinations of things. Berberine can help. But again, I can't really make a diagnosis or recommendation.
I don't know the name
over
of
the
that
phone.
Multivitamin.
I'm going to see if I can give out, I'll have to wait until I talk to them, clinician's phone number, so we can see if they can work directly with the patients. I don't know why they wouldn't, but I'll have to find that out for you. So next program, we'll be able to have that info for you. And for those of you who'd like to, at home, do a telehealth visit, a chat over the phone, we send you a prescription, get your big blood test done. A week later, do your phone discussion for all your blood work, put the vitamins together. It's a perfect way to do it. That's always the best way to do it. So that's typically what we recommend.
And there was just a response said, we like our sweets. He does play soccer, and we do go to the gym. I think Nature's Made is what he uses.
Nature's Made's good. They're very good. It's hard to say without looking at blood testing for hemoglobin A1C, fasting blood sugar, insulin, C-peptide, fructosamine, different markers of sugar to see exactly what's happening. So I'm also a big fan of those glucose monitors you can wear on your arm. And for 2 weeks or so, you get every single blood sugar reading, either with a device that would read your sugar at any time of the day or night, or it goes to your phone and you have trends as to how high and low you're going. We have a lot of people doing that because they need to know which foods are okay and which are bad. I mean, so if a person wakes up and they're dying for a bagel or pancakes and they have that, sugar's going to be high. If for lunch their sugar's okay right before lunch and they have cauliflower rice and some tomatoes and peppers and seasoning, I like Cajun seasoning on everything, your numbers will be fine. But if you're going overboard, if there's too much fruit, you got to switch over to berries because berries have much less sugar than the regular fruits do. So we have to tweak the diet, and that's a perfect way for people to see it real time. Wake up in the morning, what's your sugar doing? It looks good, okay. Have a protein powder that's got no sugar. Have some collagen peptides, good for your hair, your skin. Have your multi, maybe a couple of eggs. You can do a variety of things, but have more protein than carb. Have lots of vegetables, and you'll do well. So it helps train people to know what the good foods are. That being said, if it's Sunday morning and you want to have something that's got a lot of carb in it, and your blood sugar is 90 before you eat, and a half hour after you eat, an hour after you eat, your sugar starts to climb, goes up to 150, 160, and then you're really smart and you go do some exercise, a bike ride, elliptical, indoor bike, gym, weights, Pilates, anything. You can give a number to the decline of sugar with that exercise. So if you went for a bike ride and you dropped your sugar by 50, 60 points, brilliant. You're not letting the sugar create a problem because it's not sitting there becoming an issue for your blood vessels, your nerves, your organs, every part of your body, inside your cells. So when people are doing this and they're losing weight and their cholesterol comes down and they get to a point where their weight's great, everything's terrific, their energy and exercise capacity is up there, that's where we want them, and they want to have the carb, I say, okay, have the carb, see how high your sugar goes. Then do your exercise to get rid of the sugar. Some people will not do the exercise just to see the peak and how long that sugar stays high, which is what we might recommend initially. And then if they do that again a different day, and the sugar starts to go up, and they start the exercise an hour into it, and you're wiping it out, perfect. It's kind of our little game, the sugar game.
Someone just mentioned, thank you. I didn't think about the glucose monitor. Appreciate this.
It's a great idea. I did it myself because I want to see what it was like. Pop the thing on, simple, doesn't hurt. Tracked it to my phone, and I watched to see with what I had. Of course, if I have a cup of coffee, I put the protein powder. It's got no sugar. I put in the collagen peptides. Really has no sugar. My sugar was fine. And I'm feeling full because I had a good amount of nutrients and protein, 21 grams of protein. With some of my patients, they'll get cashew milk yogurt and put the protein powder, collagen peptides, and maybe some berries in it. Still a gram or so of carbs, nothing. And sugar stays in the great range. So that becomes very easy to create a meal plan where you're just not getting excess sugar. If you go for a run or do your exercise in the afternoon, you want to have a little something before you exercise, regular fruit, fine. 30 grams of carb from banana, orange, whatever. You'll burn right through that with the exercise. So there are ways to fine-tune the system.
Don't mind me. I'm just getting our guests ready in the background. So I want to just do your thing.
Awesomeness. So yeah, it makes it very easy from this side of the stethoscope to fix things once we know what we're dealing with. I had a patient come in the other day, and he wants to do stem cells because he believes he has Parkinson's. So he's got a tremor. We went through all the different parameters. And he said, I want to do stem cells today. I said, well, we can't do it today. We would have to order the kit to do the procedure. We need to get your prior blood work. We need to get blood work today on you to look at your parameters. We need to look at all of the other potential signs and symptoms of Parkinson's: blank facial expression, poor, scratchy, chicken scratchy handwriting, difficulty walking, getting up, moving around. Your stride becomes shorter. You may be pitched forward, bowel problem. There's a long list. And I said, what you should do is speak to your primary care, see who he likes to refer to for a neurologist, have him go through and look at all of these things, measure your arm strength. Is there cogwheel rigidity? But that's another sign of Parkinson's. Maybe do a DAT test, DAT, which tells us about what your brain looks like, or MRI. And then we really have something to hang our hat on. And then as we do the procedure, we want to track all of these things and watch them change or reverse.
All right, Doc, we got our guest ready to rock.
All righty, so we're going to take a little bit of a step sideways and speak to our wonderful guests, and we'll come back afterwards, and we'll take some more calls and questions. The two gentlemen we're speaking to today were in the armed forces and certainly have done a wonderful job for our country, and we thank them and all the gentlemen who've been, and ladies who have been in the armed forces over many years. At one point, I was talking with my mom, and I looked back and I asked how many of the aunts and uncles were in the armed forces, and everybody. Oh, all of my uncles certainly were. My dad, my uncle, my mom's brothers were, grandfathers, cousins, so many of them at that time in life, in that age. It's a wonderful thing to think about. So without further ado, let's bring the gentleman onto our screen. Do we have a split screen? There we are. Wow, triple screen. How cool is that? Let me tell you something. You're not going to find three better looking guys on a podcast today. All right? Seriously. Wonderful. So, gentlemen, how are we doing today?
Awesome.
Doing great, Doctor. Thanks for having us on.
Great. Always a pleasure. Thank you for coming on, because I want everybody to know how well you're doing, since you originally were injured, and people need to understand that your body has amazing capacity to heal itself. And this has always been an uphill battle on my side of the picture because as I started years ago in treating veterans, including Josh, who you know extremely well. I feel bad for you guys. Josh is a wonderful guy, but, it's very difficult to get funds to help to, treat the veterans. I had a political consultant. I had to go around, go to different big companies, Johnson & Johnson, very, very big companies, and wasn't able to raise funds. And Josh is doing a wonderful job bringing you guys along with some of the companies. Wounded Warrior, I think, is it Tip of the Spear? A couple of different groups that are really trying to support.
Yeah. It's a long list, yeah.
Yeah. So it's wonderful that we can get this all together. Who'd like to chat first? William?
Yeah, I'll go.
So let's give us an overview as to what had happened to you, in the past where you were initially injured.
So I served in the Army for 10 years. I was in Afghanistan in 2007 with Garrett here. And during a rescue operation, I was the lead vehicle racing out when my Humvee drove over an anti-tank mine, taking out everybody in the vehicle, destroying the vehicle. Everyone was medevac. But I struggled for, that was what, 18 years ago now. And I struggled to get any assistance from the VA. I was never diagnosed with a TBI. I was never, ever treated. Due to the urgency on the battlefield, people had broken backs, broken legs. People were, vomiting and were concussed. I was concussed for a few minutes, but I didn't have the same urgent medical needs as the other team members. So everyone else got treated except for me.
Wow.
Lo and behold, 10 years, 15 years later, I'm struggling. I'm having all these major issues, and come to learn that a lot of my friends that I served with, Garrett being one of them, Josh, who being the other, are like, Josh was really like, listen, I know exactly what you're talking about. Have you thought about stem cells? I was like, no, I got only heard of it through the news. But I was struggling with controlling my emotions, hypervigilance. One of the big things was headaches that would turn into vertigo. And I was working for a nonprofit helping veterans at the time. And one of the worst things that was happening was I'd be driving a client and I would get a headache that would turn into vertigo, and I would have to pull over, and it would become an emergency. And that was it was humiliating and debilitating at the same time.
Of course.
On top of that, I'd been taking SSRIs, antidepressants, for over 10 years, trying to treat PTSD as accessibly as possible. Not even thinking that, this was a TBI that was going undiagnosed. So, and after talking to Josh Lindstrom through the Blastology Foundation, he had me meet with you, and a lot of all the symptoms I was having, he was having. It was really aligning with the symptoms of TBIs.
It's pretty consistent, for people that don't realize this. You have to put yourself in someone else's place and, think of being in a vehicle, and the vehicle may be a little stronger than a regular car, but a bomb that's supposed to blow up large trucks for Humvees and otherwise is just going to create so much damage. And, the explosion and the implosion and the rattling of your brain inside your skull and back and forth is an overwhelming damage to those cells in your brain that make the rest of your body work. So it's a really severe scenario. People don't see this because there are no real videos of, a vehicle getting blown up, and then right there and then what happens to these gentlemen. People just don't have an understanding of it.
Yeah, and the VA especially was just pushing SSRIs and more medication. And after years of taking these antidepressants and SSRIs, I quite literally wanted to keep putting a gun in my mouth. And when the stem cell thing came across, I I absolutely jumped on it. I was like, I'll do anything to not feel like the way I was feeling. So if it was Josh Lindstrom with the Blastology Foundation who, convinced me to give this a shot, meet with you, and here we are today.
Wonderful. So when we first did the procedure, what did you start to see that you thought were some of the initial changes or initial benefits?
So the first time I went through it was, I think that was July of 24. And I didn't see any notable changes for about 9 months, like I was advised, right? And but I started hearing things from my close family members, people I lived with, cousins, parents, how my attitude was changing, how I seemed more calm, just how I talked on a daily basis. I wasn't as aggressive. I wasn't as abrasive. And that was the first things that started to come across. And so slowly I started to notice how my headaches weren't happening as frequently. I was happier more frequently. I was having less suicidal thoughts. And that was after the first session. And I've had 2 now.
Wonderful. Wonderful. More a capability to do physical activities, exercise, work out, and do coordinated things.
I just worked out for 2 hours a day.
Wow.
And that was probably the first time in a long time. I'm somebody who loves to work out. I love cardio, weightlifting. But I've had a lot of different issues from feet, back. My workouts are a little more modified than 10 years ago when I was in my 20s. Now I'm in my late 30s, so I'm not doing all the same stuff that I used to do. But today I did like a 2-hour workout, man. I'm feeling great. I'm feeling happier than I've ever been. And that's the biggest indicator to me.
And memory, focus, concentration. You had mentioned mood, of course. Yeah. Which is critically important.
Yeah. So concentration, memory, they've all had really bad problems. And I'm still seeing day-to-day changes and improvements in all those categories.
Well, those cells keep dividing. The beauty is, and the technique that's a little bit unique is that although stem cell therapy can be done in other parts of the world, a lot of companies are opting to use umbilical cord or amniotic fluid, which this country does not allow. And that's not doable or approved by the FDA in this country because you don't know what you're getting. You don't know if there are infectious issues within that host where you're taking the cord from. You don't know if there are genetic issues. How old is the cord? How long has it been frozen? Who's taking care of it? What's the chain of command? There's so much that's not known that the government rightly does not allow that to exist. As well, when they opt to use it, they may be taking a cord and cutting it into different pieces and using it for different people. What's the viability of that cord? And as I'm told, because I did a little bit more research on this, they use gamma radiation to destroy potential infection in those cells. So really, what are you getting? Are you getting anything that's alive? No. And I was assured this by some people that are big-time researchers and those that are involved in this entire realm. So you want your mesenchymal stem cells, but, it's sort of a given, and it's super obvious. Would you want to take your cells out of your body in a minute and a half, spin to separate them? They're live, they're happy, they're ready to go. Put them back in intravenously, and the unique nature of what we do is we also use a nasal droplet, so we can take some of the stem cells, drip them into the back of your nose, so it goes into your nasal cavity, and then absorbs right into your blood vessels in the back of your nose. So it goes in and directly affects and improves your brain. And proof of this, besides research, is all the patients I've seen with stroke, MS, Parkinson's, traumatic brain injury, horrible cluster suicide headaches, and all these videos, as yours, will be seen on the podcast or the website. The evidence is there. And there are people that are talking about stem cells saying, oh, no, I'm 60, I'm 70, they're all old stem cells. No, they're not. They divide every second, literally. So mesenchymal are the best source. They're yours. There's no downside, no risk or side effect, as literature and everything describes. And people think, oh, well, I want to get the umbilical because it's young. Yeah, but Your stem cells aren't made when you're born and they live until your age. They're not old. There's no such thing. That's just a sales point for people that want to charge you crazy money for doing the umbilical or the amniotic fluid. We even had a patient with MS who went down to Mexico because she wanted to see what it was all about. And they told her, based on her condition or specifics, that they were going to charge her $60,000. I said, that's insane. Why would it be twice as much as they normally charge? And that's still too much. You know, we're talking about a fraction of that. So they wanted to give her chemo before they did the stem cells. I said, why would you do that? You have damaged neurologic tissue. Why would you put chemo to damage more cells before you put someone else's stem cells back in? Just, it's insane. Makes no sense.
There's a higher risk of cancer with that form.
There is a higher risk, absolutely, because you're putting things in that do not have the communication, you know, with the rest of your body as your cells do. Who would want to put in foreign gamma radiated, not even talking about the chemo add-on, but who'd want to put that in their body to expect benefit? Or just your own cells taken out in a minute and a half, spun, put back in. They're out, put back in a half hour. There's just there's no discussion, no argument there. And we have thousands of patients that I've treated over the decade or so, and then that have had wonderful results. You can see it. So, and certainly you gentlemen are, you know, the perfect example of that. How is our buddy Garrett? Does he
Fantastic, Doc. Thanks for
chat a little bit, buddy?
Sure. I mean, I'll just be explaining the same story again. Madigan, or Will's and I's stories, they're essentially parallel paths. We served together in 2007, and we were both in IEDs. I had a few other incidences of blast exposure, and I got some shrapnel in me from that rescue that Will was hit on. He was on his way out to pick up what was left of our squad from that trip. We'd been ambushed, and I believe we'd taken about 4 casualties at that point. I'd gotten rocked by an RPG. I had some bullet fragments in me. We had a couple guys get shot. Another guy took an RPG to the leg. So it was a pretty bad day. We had, I want to say it was maybe 8 or 9 casualties on that day alone. Wow. So, and that was one day in May. We'd had a number of busy days like that before. That was a particularly bad day. It's actually the tattoo on my arm is the valley that happened in, just north of us. So it was a busy day. Thankful Madigan was able to make it through that, but his truck and Josh was on the way out to pick us up or provide reinforcements. We were pinned down.
So they were hit before they got to you.
Yeah. So it was a complex ambush. They'd caught us in a choke point by a river. They initiated with an RPG. That hit me right off the bat. It hit the tree I was sitting behind. I got bounced a few feet, and then
you were outside of the vehicle.
I was on foot. we were a dismounted patrol that we'd sent up into the valley. Plan being that we would initiate some kind of contact, and then the trucks, once we were in contact, would come and provide fire support for us, because the terrain in that area was so mountainous that really the only way to get around was on foot. There's a YouTube documentary called Foot Patrol. It's about Balo, Afghanistan, where we were at, and the inaccessibility of it. I mean, some of the mountains around there were over 10,000 feet. The tallest in the area was about 14,000 feet. So it was extremely mountainous, difficult to traverse. And the way that we would deal with that was we would send out a patrol that could initiate contact with the Taliban. And then from there, we would send in QRF, which is what Will was on, to kind of help establish fire superiority. Because in reality, I mean, they had just as much firepower as we did. They had heavy machine guns they could tote around. I mean, we were walking everything on foot. So, whatever it was to get out there, we had to carry it. And they were in place, so they had the advantage. But they had initiated the ambush. They took, not me out of the fight, but they rattled my bell pretty early on. The next volley fire of RPG took out our 240 gunner. And then in quick succession, the medic had been shot trying to render care
Wow.
to the 240 gunner, and our RTO was he was shot next to me. So we had in pretty quick succession, we had a number of guys taken out of the fight, and we just spent the next 45 minutes getting chewed apart. We didn't know. I mean, when we were pinned down, we were wondering where the support was, and we didn't find out until Josh came up and walked up on us. We're like, "That's weird. What are you doing here?" And he's like, "Yeah, we're the QRF." And they took a short lull in the fighting to as we gathered our casualties, and that's when we found out that the support had hit an IED on the
Wow.
way, and there was, more casualties. And obviously, you worry about, who was hurt, who was injured. We knew that a couple guys had been medevaced, and
Wow.
yeah, it wasn't until we got back that we saw the full extent of that, that individual attack. I want to say it was, I mean, Willie, what was there, four guys in your truck that were medevaced? Five guys, one, two, three, four. Yeah. So four guys from you.
Wow. How did you finally get out of
That's
there?
good to go. Well, Josh's squad came up and we just established a quick cordon. We were able to medevac the casualties, get them out. We regrouped, and even while we were trying to exfil, we were dealing with the continued fire from them. They kept, the trucks that were able to get out there were lighting up the hillside. We had some fast movers, some jets came in, but they were so close to us they couldn't drop bombs. I mean, we were only within maybe 200 or 300 meters of
Wow.
where they had initiated the ambush, so they couldn't drop bombs, and we just kind of had to eat it for the most part. But once Josh's team got up there, reconvened, got everything together, I had one magazine left. I was covered in blood. I'd been plugging. I put my hand on the gunshot wound of the guy next to me because it went through his armor plating. They were firing armor piercing rounds,
Wow.
so they chewed us up pretty good. It was not a good day to be in the
Wow.
infantry. So
Unbelievable. So the first things you started to realize, and you've had a variety of different injuries or traumatic brain injuries or concussions and such over time, right? What were the first things you started
yeah,
to realize?
it wasn't until I'd been out at that point for about 2 years. I did 9 years, and same as Will, we we wouldn't have known. The VA didn't recognize when we got out that TBI was part or was going to be the issue that it was. I stayed in for another 5 years after I did another deployment with 1 4 infantry, and then I got out and did some National Guard time. And I knew things were happening. I knew my memory wasn't as sharp as I felt like it should be. Extremely volatile. Obviously, I went through the whole gamut of symptoms that we all do through PTSD. You get as soon as you get to the VA, they throw a diagnosis. They say PTSD. That's why you can't sleep. That's your nightmares. That's why you forget stuff. That's why you're emotionally dysregulated. That's why you're having issues with your family. That's why you're drinking too much. And as soon as I got out, I knew that things were not normal. I'd just gotten married to my wife, and so I had to do something. So I quit drinking. I signed up with the VA immediately, started going once a week to counseling, and I got the same. I was offered prescriptions, but I knew I'd forget them. I knew I'd forget the pills. Like that's
Yeah.
a limitation of mine. Like I forget things daily, my car keys, where I left this, where I left that. And I knew that if I was given pills, I wouldn't be able to regulate that. And
Right.
my wife wasn't, she was in college at the time, so we weren't focused on
And the
getting
pills,
better.
yeah,
We were just
pills aren't
focusing.
fixing anything. The pills are not giving
No,
you
and
new
and,
brain
and
cells. The pills are not correcting, an injury.
exactly. And I knew I'm more about treating the issue, not the symptoms. And the issues that I were having, I was like, well, I just got to get right. I need to focus on my mental health. I need to exercise. I need to stay healthy and, not drink. I wasn't drinking or doing any drugs at the time. So I was like, if I focus on this, it'll get better. And it didn't. I tried everything that I could through the VA, every program through meditation, and there was underlying issues that simply would not go away. They
Yeah.
were physical limitations that I was just, smashing my head into,
Yeah.
mostly with memory and not being able to regulate my emotions, not being able to just be a normal human being. And obviously, you develop some hyper awareness from experiences like that. I'm not saying that PTSD it can't cause issues in your life. It most assuredly can. But I knew that's why I would have nightmares. I knew that's why
Hmm.
I would, that's why how I could be volatile, if I drank. That's why I was like, all right, cool.
Yeah.
I just won't drink. That's an easy solution.
Yeah. There's an
But
old
there was
saying:
physical.
you could wash the car all you want, and you could, put tire shine on the tires, but it's not going to help the engine. Your car's not going to run well. I mean, you need to
Yeah, if you
correct,
got a hoopty,
where the damage is.
yeah, if you got a hoopty, you're driving a hoopty, and I kept running into these, and it wasn't until a suicide. I tried to hang myself that I realized something was very, very wrong. And at the time, I hadn't been diagnosed with TBI. The VA just said, you have PTSD, try these antidepressants, try these, different sleeping pills. And so
Makes
finally
me
it
angry.
culminated in that. And it's divine intervention. I don't know how Josh even got my phone number, but out of the blue, I was on my way. I'd already packed up. I was on my way to a 45-day PTSD treatment program in Helena, Montana, where I'm in Montana, so it's a couple hours from here. I had packed already. I had called. I was going to go stay with my folks for a few days so that I could cool and then go to it. And out of nowhere, Josh Lindstrom, he called and said, "Hey, how you doing?" And I was like, "That's funny that you're calling." And I just told him where I was at. I was like, "I'm on my way to a PTSD program." And he's like, "Hey, man, you might have some things going on that the VA is not looking at." And he said, "You shut up, I'll talk." And that's what he did for the next 45 minutes and explains,
Yeah.
his story, which paralleled exactly with
Yeah.
Will's story, that,
Yeah. Of
we're
course.
all running into this same limitation and what the underlying cause could be. Because until then, I'd never heard what TBI was.
Yeah.
And it wasn't until Josh had said that. And I actually looked through my VA records. And from when I left active duty until I joined the Guard, I had been flagged for TBI, like 17 individual times in my
Yeah.
VA records. It says, this man
Yeah.
needs treatment. There was a
And they don't do anything about it.
polytrauma team,
It's amazing. They'll
but
just throw
they,
drug, 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 and counseling, which I think certainly counseling is a great idea, but it's not fixing the damage to the cells and to the brain. You also had some neurologic manifestations. You had mentioned MS at one point, where they thought you may have had
yeah.
that.
And after I started, the TBI treatment, Josh had given some ways to sort of navigate that. In 2019, I was coming back from a veterans retreat in Chicago, and my feet quit working. I couldn't feel them anymore, and I ended up being bedbound for a couple days before going to the VA. And they said, we don't know what it is. So I just went to the emergency room. They did a spinal tap, and they found copper in my spinal fluid, and on top of it, they were said, "Well, you have MS." And the initial diagnosis was progressive MS. It had started, and for the first week, I was bedbound, couldn't walk, and
Hmm.
then it kept progressing after that.
Wow.
So, and they believe that that's in relation to some of the metal, some of the shrapnel in me,
Sure.
and some of the heavy metal exposure from burn pits and being blown up,
Sure.
wrecked
And
from the
sheer
truck and stuff
damage,
like that.
to the brain and those cells being damaged and the sheath being damaged. Yeah, that's as bad as
It's
it
yeah,
gets from everything you've been exposed to.
yeah, and I got blown up like six times. I got shot in the helmet another time. So I'd had a number of knocks to the nugget, and all of this, basically what they said was, we don't know what causes it. We don't have an idea for it. But ever since, so before coming and seeing you, just to segue into the treatment of this, before coming to see you, I've been diagnosed with progressive MS. They weren't sure how long I had left. I'd spent in and out of the
Hmm.
hospital. I was having a flare about every month or so. It didn't really look like there was remission in the in the MS.
And there
It
you did
looked more
MRIs and things to actually look at the brain
Oh yeah.
and
Oh
damage
yeah.
to the
I've got
sheath. Yeah,
a trail of
super
MRIs,
evident. Yeah,
from,
yeah.
they have a huge, laundry list of lesions that, they started in the spinal cord, which is, affected. I couldn't walk for a while, couldn't drive for about a year. I was in a wheelchair for a little while. More or less bedbound. I had a nurse in home treating me. They tried aggressive intravenous steroids. I went through that treatment probably 6 times that first year, and all that was doing was dampening down the inflammation. But it was still, I mean, my brain was scarring, my spinal cord was scarring, and the initial prognosis was not good.
Of
And
course, of course.
they tried a number of disease-modifying agents, from Copaxone to Tecfidera, and I still have a TBI. I forget things. I'm bad at taking medicine. And secondly, like the treatments were worse than what I was dealing
Right,
with. Like obviously
right.
not walking sucks, but these treatments were painful.
Yeah.
I was having, harsh reactions with the injections.
The strange thing
And
too, is not to interrupt, but when they give you a medication, they have no idea whether it's going to work or not, or help or not. They just say, "We'll try this, we'll try that. Oh, let's see." They have no idea, and
oh
and
yeah,
that's
they're
true
just
for all
organic
medical
mechanics.
conditions, blood pressure, cholesterol, anything else. And then sometimes the meds have to be stopped because of the side effect, and there's no benefit. So it's just bad,
And I wasn't having any benefits. I mean, they were guess and check. And finally, Marina and I just decided to, like, hey, you know what? We're just going to let this run its course. If it's going to be what it's going to be, it's going to be. So we just had our firstborn son, and we moved to Texas. I just quit going to the doctor. I would have lesions and flare-ups where I was, not hospitalized, but I just let it run. I figured put it in God's hands and see where that goes. And it wasn't until Josh contacted me again about the stem cells. I believe I told him about the MS at that point, but we hadn't discussed it in detail. And he said, "Hey, I've got an idea. It helped me. It's helped a couple other guys. I think you should look into it." And leap of faith. I was in the middle of a flare actually at the time. I'd just gotten done with a pretty tough dose of steroids, and I'd lost 60 pounds. I think I was down to like 170 when I came to your office. Yeah, it was November or October of 2024. And then Josh said, "Hey, if you can make it, I've got you an appointment in November. I think you should go." And I went. I came. We met with Joel. Josh came over, and I had the treatment. And since then, I've had no new lesions. I've had no symptoms. I've had I've had MRIs. There's been no new evidence of the MS progressing. For my particular case, it felt like a miracle.
Yeah.
Like Madigan, like Will said, it's not me saying I'm better. It's my parents being like, "You've changed. There's something different about you."
Sure.
It's, my wife, it's my friends, it's people that have come up and said, like, "Hey man, you're way better than you were." Obviously I'm a little more weight than I was when I saw you last time, but
Yeah.
I'm working out every day again.
I was to say, your
I'm
arms are
back.
gigantic, dude. You got some big ass arms there.
Will and I actually got a chance to go to the gym while we were, over visiting this last couple of weeks ago. Yeah, we went to the
Good,
gym,
good.
worked out for a little bit.
Awesome.
So
Well, it's
it's
better to
been a
be able to
complete
gain the
turnaround.
weight and to get your strength and do all that than not. And remember, your brain leads and everything else follows. So you can't really do well with training and weights and your daily activities if your brain is constantly not making the neurotransmitters and not letting that electrical flow along the sheath actually happen. So yeah, it's thrilling to see you guys and all the guys we've treated, and certainly Josh as well. All the guys that I've treated, a few dozen over the years. Originally, years back, there was a brother, two brothers in Florida had a insurance company, and they would set up week-long resorts or retreats for the wounded veterans to go and speak with therapists and things. And someone had connected me with them, and I think that's where I met Josh. And we've treated a bunch of guys since then. So my goal is to continue to do as much of this as possible. I have a patient who's also on one of the videos here on the podcast, Dominic, and he's a veteran, and he blew up his shoulder. His shoulder's great now. He's very articulate. He's a judge, a lawyer, and he's going down to D.C. now, and he's working with people at a variety of agencies, and he's sworn to me that he's going to, get in and get to speak to the right people so I could go down there and, plead my case in front of the big guys. So we're still working on it. I told Josh, as soon as this happens, if you guys want to come, we just get a group and we all go down there. We'll fly you down and get you set up, and you could talk to the people who make a difference, and we'll get more of it done, I want to treat everybody. I want to treat every veteran that's been injured in any way.
Absolutely. I believe this is probably the most effective treatment I've ever seen. And it's hard that the VA is not recognizing that. Obviously, any new treatment goes through the role before it becomes mainstream. And, whether it's an experimental or not, walking proof like this has helped me exponentially.
That's a great comment. So the term experimental would make any person think, oh, they're trying to see if it works. Now, the term stem cell itself was created by a German doctor 160 years ago, something like that. And subsequent worldwide research on stem cells is in the millions. You can go on Google Scholar, plug in the word stem cell therapy. You'll see 5-6 million citations and studies. You could look up stem cell therapy for Alzheimer's, Parkinson's, stroke, traumatic brain injury. You could look up for liver, kidney, heart failure, lupus, rheumatoid, diabetes, pulmonary fibrosis, COPD. The list goes on and on and on. It's not an experiment where you think, we don't know what's going to happen. You can see what's going to happen, and you gentlemen have felt what's happening and will continue to happen. So, traditional medicine makes decisions at the VA facilities. Traditional medicine is bound by what they want to do to control the mechanism. And as I've mentioned to patients, here's a pharmaceutical interest, here's the insurance company. They control what traditional doctors do. And the insurance company doesn't want to spend money on visits, so they pay less and less for visits. The doctor sees you very quickly, doesn't have enough time to spend time with you. They don't look into different treatments or things that might help you because they don't have the time. They don't want to be that guy who steps out of the box and says, oh, here's something that I've seen and researched, because the other doctors that they know in their box will not refer to them. And if the ortho world doesn't want STEM to work for some of the joint injuries, then it's something that's not going to be looked upon favorably, because they make a lot of money for joint surgery. And the same for doctors that have patients who are diabetic. It's pills, insulin shots. And people that are diabetic live shorter lives because of that. Damage to nerves, blood vessels, organs, eyes, everywhere. But you can see videos on the website as well where we've taken people that are diabetic in 2 to 4 months. 60, 70-year-old patients are not diabetic anymore, and they're off their meds. So it's a no-brainer. The idea is that you'd rather use your own body's ability to help repair yourself than to be on meds. But they don't want that to happen. This is something they just do not want to happen because it interferes with their game. And anybody who's got an inkling of understanding of how the world works and following the money trail and the whole vaccine thing now, because this is all boiling up, and now the cancer realm, we get out of the World Health Organization, and now there's cures for cancer coming out of Russia and China and Japan. Where was that before? How come no one said anything about it before? It's unfortunate, but we're being played. So,
yeah, there's no money in the cure.
No. Use your body to create your health. Fine-tune, eat right, exercise, get on your vitamins, hormones, etc., to create your best outcome. When I look forward to seeing you two guys again. When are you guys coming again?
Maddie's got a trip. When are you heading to Nicaragua, bud?
Nice.
I don't know, this week sometime.
Nice. Is that for a vacation or for going fishing, or just going to hang out and relax?
Just going to hang out and travel. I love traveling by myself down there, learning Spanish. I feel like a human again, being able to go down there,
of course,
do these things. And Yeah, and
That's
you know what?
terrific. Well, I want to see
I
some
go down there.
pictures. I want to see all sorts of cool stuff that you're doing down there.
Oh, you will. Yeah, man. I go down there and everything I eat's organic and natural.
Yeah. Can't beat
You're in the
that.
sun every day. You're in the ocean. Yeah.
Wow. Impressive. Sounds like a great trip. And
So, but
similar,
we'll be back at
Garrett,
your office.
when are we going to have you
March.
come back? I know we're
March.
trying to
I'll
schedule
be,
March.
Yeah. How about the when as soon as Will's back, it's a quick flight over.
Yeah, come up.
I'll just be coming over. I come with the same
You
trip.
could
come
bring
over,
Josh.
see
We'll go out to
Will.
dinner. We'll hang out.
He
And
was
we're
supposed
all
to come
praying
last
for
time.
Josh to
He's
pass
studying,
his exam.
studying for the bar. Yeah.
I know. He's killing it.
Yeah,
So, yeah, we're praying for him to pass. We'll have to take him out and have some fun. Great stuff, guys. Thank you so much for coming on. We'd love to have you guys back on for updates and things, and that would be great. And certainly, Marina, your wife, she's doing a wonderful job, and was chatting with her before she got this all set up, and she's helping us with the social media and all that. So I'm very excited too. So.
Yeah, we're all on board. We all want to push. We all want to help this grow. I think that this is a fantastic treatment. I believe in it. I'm a walking case study at this point. Like, it has helped everyone that I've seen do it in my immediate circle. Anybody that we met at your office in the last 2 times that we've been there, it's helping people, and that's part of what
Yeah, in a way that nothing else can. In a way that nothing else can work. What would be better than using your own cells from your body, not something else, to fix or repair damage, degeneration, inflammation, and some of the worst diseases that you can see have great results with STEM. So it'll always be an uphill battle because you have a concentrated effort against it. But, the more people we enlist, the more people we get together, and put behind it, the better. And I love the fact that RFK Jr. is there and doing a spectacular job. I would love to be able to have a discussion with him or go to meet him. And we're also trying to get in contact with Dr. McCullough. So, with any luck, over the next couple of weeks and months, we should be able to get closer and closer to the people who make the decisions. And, of course, we'll get you guys to come to D.C. and meet these guys, too. That'd be great.
Yeah, keep moving the goalpost.
Yeah.
Yeah.
We'll keep you posted. All right, gentlemen. Thank you so much for coming on the show today.
so
God
much.
bless you all. A million ways to Sunday. God bless you guys. And we'll talk to you soon. Okay.
Thanks, Doc.
Bye-bye now. What great people. Ay. It's kind of like my crusade, and one of the things that I feel so strongly about and want to do so much with, certainly for wounded veterans, all our patients with stroke, MS, Parkinson's, all of these things. We want this to be a forefront. It's just a little bit of a battle, so we have to, just keep working at it. And that's what I do. That's why the podcast here is so important. I love the fact that LFA and Rumble and our audience is growing like crazy. We've had over 200,000 views since we started the Saturday program. I think the numbers will keep increasing. We have thousands of people going to Instagram, YouTube, and TikTok, and now we'll have a lot more information coming out. The website will have a lot of information coming out, so we're just going to keep pushing. That's all. It's what you have to do. Never give up. Always keep moving. Do we have any comments or questions on?
Definitely plenty of comments from that interview. Someone said amazing men and their experiences are strong reminders of how much our service members give up for this country. God bless them and their families. We could never repay you for what you have done for us. Amen to that.
It's amazing what they go through that you'll never hear about and never know about. And they're not looking for recognition for what they've gone through. The least we could do is support them and try to repair and help them, So we'll try to create as much ground swelling for this as possible, and then we'll kind of reset, the foundation so we could try to raise funds and, we'll get as many different people as possible on board to help do that so we can, get more treatment done. I think Josh is saying at one point there are thousands and thousands and thousands of veterans who need this, and we'll treat every one of them. Mm-hmm. I'll do it. we'll do it. So
let's go.
It's a tough topic to think about, and the more you think about it, you can get in depth in it, and you could feel really horrible that for so many years all the veterans have given up so much for us, and the governments in past have just done nothing.
Time after time. Trump is a good change of pace. But
yep, still. The change is occurring, so it's going to happen. The change will occur. Any other comments or questions?
Yeah, we got a thank you, Dr. Chris, for your continuing efforts to support and help them.
My pleasure. It's one of the greatest things that I could ever think of doing,
Yeah. What else we got? This was regarding, I believe, just big pharma and all that. Someone said, keep us sick for as long as we live, and they don't want us around too long. You'll eat the bugs. Someone said.
Yeah, think of it. You don't have to be conspiracy minded. And honestly, I think people who start to look at conspiracy theories and start to understand what's behind it are realizing that this is true stuff. And if you are a bad guy, you're going to do something, you're going to try to make it so that it looks like a conspiracy theory, and you try to say, oh, no, you're wrong. Here's a conspiracy theory. No, these things are real. That's their way to try to throw you off the track. But these things are real. So you've got to educate yourself as much as possible, get rid of the junk foods. It's outstanding to me, or it's unbearable to me to think that food manufacturers, when they make food for here, and for kids, of course, it's all this garbage in the food, but they don't make it that way for other countries. It's unbearable to think the pharmaceutical industry will sell a drug to another country for a fraction of what they sell it to here. We're just being abused over and over again. Look at the USAID thing. All this money is going out for garbage and nonsense, and it's going back to the politicians on the bad side, on the wrong side. That's what they do. That's where they get all their money from. And more of it's going to keep coming out. You allow a certain population of people in Minnesota to steal billions of dollars, and the governor knows, and the attorney general knows, because they're part of it. Don't be foolish, people. They're part of it. Their day's got to come. Get all that money back. Stop spending money on all these other nonsense things, and give the American people a break, and get rid of the taxes as you can. Save all that, the trillions of dollars, save all that, and people shouldn't be paying for taxes for every little thing they do. So,
amen.
You got to give a hand to the administration for doing all of this. And I think more greater things are going to come too. So let's watch and see and hope and pray.
Oh, yeah.
All righty. We're down at the end of the program. Thank you for listening.
Quite a program.
Have a wonderful day, wonderful weekend. God bless you all. Certainly, you can go to the Instagram page, Dr. Chris Calapai. Same with Facebook and TikTok. We'd love for you to take a look, and we're going to put a lot of stuff on there. Please give us a call at the office if you like, 516-794-0404. The website is drcalapai.com. If you'd like some info on RPM, remote patient monitoring, getting us to send you a blood pressure cuff, a glucometer, now the Ring, a watch, whether Apple Watch or a Samsung Watch are becoming available. A wrist band or bracelet can track and look at all of your parameters and just goes directly to us, so we can track you and keep you healthy. If you look at what we've created with Stay Strong, it's a way for people to utilize the benefits of what we're doing that may never be able to come into the office. So if you live out of state, you live far away, we can set up the phone consult with you, get your blood work done, make recommendations for vitamins, minerals, hormones, peptides, all of these things, and make you very healthy. Relatively soon, we'll have something where a platform, you can take pictures of your blood work from recent or prior and send copies of that to this platform. And the AI mechanism that I've trained will read your blood work far greater than any traditional mechanism, and then discuss with you diet, exercise, vitamins, minerals. You can set up telehealth visits through that. You can get on the peptides, hormones. So it's going to be a mechanism for everybody. So we've got some pretty brilliant people working on this. And, with the help of AI, this is a whole new world, people. But a whole new world for great things. Not a whole new world for some sort of insanity like you might see on some of the social media posts. But the overwhelming wealth of knowledge of AI can give you so much more information that you could never, ever have before. I know doctors that are radiologists that use AI to read the reports and create the report, and the doctor reviews it, double checks it. If he likes it, signs off on it, adds his own little tidbits. But I use the word tidbits a lot. Maybe I'm in the mood for steak tidbits. Maybe that's why it's popping up in the back of my brain. So the doctor can make his comments, and now you have a report that's probably read better. It's being used in every walk of life. Architects that I know love it to death because it's putting together complicated architecture plans that would take forever to do otherwise. Attorneys are using it. So I think it can be used for the greater good, especially in the realm of medicine. So very excited about it. I tell the story that my first exposure to it was when a young lady who was a PA was working in the office doing a rotation through her school, and she asked me about it. I said, I haven't done anything with it, tell me. So we got on ChatGPT, and I popped it into my phone, of course, right away. And I said, give me a 2-minute discussion of vitamin D and how deficiency correlates with different cancers, and give me medical documentation from research facilities and universities, peer review, that supports it. Click. As soon as we hit the button, it was done. I can't even say it took 2 seconds because it didn't. It took like a millisecond. And I looked at it and I was kind of blown away thinking, how did that happen so fast? But if you think about it, all of the questions that have ever been asked through Google and all of these search engines makes the most massive database of information. So it's just quickly throwing it right onto the page. And I was blown away. Of course, I used it to talk about, things in the practice. But now, as opposed to me getting on the computer for a half hour or an hour looking at different things, very similarly, I can get on and say, how many people die every year from, coronary blockage or thrombosis, or how many people have this or have that, or just like the information we spoke about today, vitamin deficiency or vitamins preventing cancer. Information is at your fingertips, and the most time-consuming part of it is moving your finger to press a button. That's the time-limiting step, is pressing either your phone or your computer. It has everything for you. So, very happy, very excited about all of this, and we'll just keep pushing. And we'll give you the updates every week as we can.
And you're getting some happy Valentine's Day, Doc.
Oh, right. For everyone out there, have a wonderful, healthy, happy Valentine's Day. Enjoy your chocolates, enjoy your champagne, whatever else. Enjoy yourself. Have a wonderful weekend. We'll talk to you soon.